the topic of discussion that we are going to talk about is we'll be dealing with stomach, and after knowing about the brief anatomy of stomach, what we'll do is we'll move toward gastropathy, right? And we'll discussing about stomach, we'll be talking about its anatomical structure. We'll be dealing with about various factors that acts as damaging factor and protective factor, right? We'll go through the diagram mentioned in our Robbins, and then what we'll do is we'll differentiate gastropathy with gastritis, and we'll study about the different type of gastropathies, right, such as meningeal disease, and similarly another one is Zollinger-Ellison syndrome. Okay, now without delay, let us move toward the stomach part. Okay, now okay, and after these things, what we'll do is we'll correlate all these things with the thing that is mentioned in Robbins, as you can see right here, the stomach portion and gastropathy and acute gastritis. We'll not cover acute gastritis right here. We'll be talking about gastropathies only. So now without delay, let's move toward the topic of discussion, and that is stomach and gastropathy. Now talking about stomach, initially I would like to take you toward the diagram of stomach. So if you'll see right here, what you will see is you will see one important structure right here, one important part of stomach, and that is what? Cardia part, right? What is this? See, cardia part. Now what is this cardia part? This cardia part is, what is this? This is the continuation of esophagus, right? Continuation of esophagus. Similarly, if you'll see the structure right here, then what is this? This is fundus. What is this? This is our fundus. Now what is the importance of fundus is that the fundus is what? The fundus, it is dome shaped, right? What is this? This is dome shaped. It is dome shaped, and it is responsible for normal gastric air bubble, right? It is responsible for normal gastric air bubbles, right? And these air bubbles, where we'll find these air bubbles, these are seen in X-ray, right? When we are doing the X-ray of our abdomen region, we'll see we'll see this gastric air bubbles. So these gastric air bubbles are mainly present in dome-shaped structure, and that is our fundus. Okay, now moving further, the main part of stomach, that is our body, right? You can see the main large portion of our stomach, that is our body. The continuation of our body is the antrum, and finally this antrum ends with what? With pyloric part. Okay, these are the main the structure of stomach. So now what we'll do is, now we will just look toward various cells that are present in our stomach region, and so having histological link, what we'll do is we'll talk about different cells. So the cells present in stomach region are our parietal cells. The important function of parietal cell is it secretes intrinsic factor that helps in absorption of vitamin B12, right? Vitamin B12. Okay. Okay, similarly it secretes HCl, right? That is our gastric juice, and this HCl secretion is enhanced by our acetylcholine, histamine and gastrins, right? These are the stimulatory factor that increases the activity of parietal cells and causes increase in secretion of HCl. Similarly, talking about other things, what we have is we have chip cells. Now what are these chip cells? Chip cells are the one that will secrete pepsinogen, and similarly moving further, we have foveolar cells. These secrete mucin, and these are protective in nature. Okay, we'll just later on just look here in detail in this protective factors topic. So what are these G cells? G cells are located in antrum region. As you can see, this is our antrum region. These are located in our antrum region, and located in antrum region, they secrete what? Gastrin. They secrete gastrin that enhances the production of HCl. But if you'll see the characteristics of HCl, then the higher production of HCl will just it will reduce the secretion of gastrin through negative feedback mechanism or feedback inhibitory actions. So now moving forward, what we studied till now, we studied about general anatomy, right? We talked about histological part, the different cells. Now let's talk about the damaging factor and protective factor. Now why are these important? Damaging factor and protective factor. This protective factor, what they would do is they protect our what? Our stomach, right? Stomach mucosal lining from what? From corrosive acid HCl, gastric juice, right? Such as what we have is we have epithelial regenerative capacity, right? If something will be disturbed or something, our cell will be dead in region of stomach, then they will soon be regenerated. Similarly, we have mucus, as you have seen right here. We discuss about mucus. Now these mucus are also our protective factor. Our these bicarbonate, these are also protective factor. What they will do, they will neutralize with HCl, right, which is one of our damaging factor. Similarly, we have prostaglandins. Now what are these prostaglandins doing? If you recall, if you'll recall the concepts, what we have is from cell membrane we have arachidonic acid, right? Arachidonic acid, what it will do is the COX enzyme will take place here and it will be converted into prostaglandins, right? Now this prostaglandin, what it will do is it will increase mucus production, and this mucus production is what is the protective factor, right? Now if these prostaglandins will not be produced or this COX enzyme will be inhibited, then what our protection will be reduced, and this is done by what? NSAIDs, right? NSAIDs, and one most popular NSAID is our aspirin, right? So intake of aspirin, what it will do is it will increase the risks, right? It will increase the risk of inflammation of our gastric region. So that's all. Similarly, what prostaglandin will do, it will increase mucus production, it will increase SCO3 production, it will decrease HCl secretion. It is also one of the important thing, right? It will just decrease HCl secretion. Now okay, now one important thing that I would like to relate, I would like to keep here is there should be balance between damaging factor and protecting factor, right? In order for our stomach to be in healthy condition. So just disbalance in any of this factor, what it will cause, there will be increase in risks of inflammation in our gastric region, such as damaging factor such as HCl will be produced in excessive amount that bicarbonate will not be able. If bicarbonate will not able to neutralize this HCl, then obviously there would be inflammation in our gastric region. Similarly, there are injuries, right, that also acts as the agent to cause damage in our stomach region, such as we have H. pylori. Now what is this H. pylori causing? It is causing irritation to parietal cells, right? And these parietal cells, what they will do is they will enhance the secretion of acid. They will cause enhancement in secretion of acid, and this will cause damage to gastric epithelial cell, right? As the acid will be produced in enormous quantity, they will act against gastric epithelial cells, and that will eventually cause the gastric inflammations. Okay, now these are our the damaging and protective factors. If you'll see right here, what you'll see right here, you'll see the protective factor. These are surface mucus, right? Mucus secretions. We have bicarbonate, we have mucosal blood flow, we have epithelial barrier functions, we have epithelial regeneration, right? We have prostaglandins. These are our protective factors. Now similarly, talking about our damaging factors, what we have gastric acidity, HCl, peptic enzyme are also the damaging factor. Similarly, injury, we talked about H. pylori infection, right? We talked about NSAIDs. Similarly, tobacco, alcohol, gastric hyperacidity, right? The same thing, duodenal gastric reflux. These are also these are the damaging factor, right? That causes damage through injury. Okay, as you can see right here the damaging factor and the protective factor, they are in balance, so everything is in proper condition right here. But here the injurious substance are increasing so much, so because of which you can see there is increase in damage or impaired defenses, right? As you can see right here, and eventually this will progress, there will be the condition of ulcer. So now as we have known about stomach, right, about its defensive and protective, damaging factors. Now I would like to take you toward the condition in which we will differentiate our gastritis and gastropathy. Now the thing is, what we'll do is, okay, such as this is our stomach. Okay, this is our stomach, right? This is our stomach. Now here is our mucosal lining, right? Here is our mucosa, right? Mucosa. Now, because of something, there will be injury in our mucosa, right? There will be injury in our mucosa, such as mucosal injury is happening here, right? Now, because of injury, what will happen, that there will be two conditions. The one condition is the condition in which there will be what? There will be WBC infiltration, right? Neutrophilic infiltration, right? There will be WBC's infiltration, and okay, this is our what? WBC infiltration. Now, when there will be WBC infiltration, what we'll call this condition? We'll call this condition gastritis, right? Gastritis, gastritis. But there will be another condition in which there will be no WBC infiltration, right? There will be no WBC infiltration, but there will be what? There will be the presence of what? Regenerative. There will be regenerative. There will be not WBC infiltration, but there will be what? There will be regenerative cells, right? There will be regenerative cells. There will be regenerative cells. As there will regenerative cells, there will be also hypertrophed. The cell size will be increased. The cells will undergo hypertrophy, right? Okay. Now, this condition in which there will be no WBC infiltration, we'll call this condition as gastropathy. What we'll call? Gastropathy. Okay. What I said till now, the thing that I said is, right, cell injury. Okay, here is cell injury, right? Here gastropathy is a cell injury, right? Cell injury in which there will be what? Regenerative presence of regenerative cells, but without any infiltration, right? Without any infiltration of our what? Inflammatory cells. Okay. Now, here what will happen is, there will be, as we have said, that there are regenerative cells and the cells are increasing in size, right? Increase in number of cell and increase in size of cell, both will happen here. So this is also called hypertrophic gastropathies. What it is also called? It is called hypertrophic gastropathies, right? Okay. Now, under these hypertrophic gastropathies, we'll be studying about two conditions, right? We'll be talking about two conditions. And what are these two conditions? These two conditions are what? Zollinger-Ellison syndrome. One is Zollinger-Ellison syndrome, right? And another is our what we call this condition, meningeal disease. What we'll call? We'll call one meningeal disease, and another that we'll call is Zollinger-Ellison syndrome. One is meningeal disease and another is Zollinger-Ellison syndrome. Okay. Now, talking about meningeal disease and Zollinger-Ellison syndrome, now what we'll do is we'll study about meningeal disease. Now, this meningeal disease, what will happen here is, right, the first thing, let us go through name only. This meningeal disease here, it will be mainly caused in men, right? It will be mainly caused in men, and the men are of middle age, right? That means 40 to 60 year aged, right? These will mainly occur in men, and in the case of middle age, 40 to 60 years, right? And what will happen in this meningeal disease is that it will cause what? It will cause the oversecretion of our TGF alpha. Now, what is this TGF alpha? This TGF alpha is our what? This is transforming growth factor. What is this? This is our transforming growth factor alpha. Now, let us recall another transforming growth factor beta. The transforming growth factor beta plays important role in the case of wound healing. So now here, since this transforming growth factor alpha is secreted in high quantity, cause what? It will cause increase in proliferation of epithelial cells. What it will do? It will cause increase in proliferation of epithelial cells, epithelial cells, right? As there will be increase in proliferation of epithelial cells, what will happen? There will be prominent gastric rugal folds, right? There will be prominent what? Gastric rugae fold, right? Folds. Now this condition here, this prominent gastric rugal fold will be appeared in a form of what? It will be appeared in a form of our what? It will be appeared in a form of our bag of worms. So this condition is also called bag of worm condition. Okay, what do we study till now? We are under the topic of gastropathies, and under that gastropathies we are talking about what? Meningeal disease, and in this meningeal disease we talked about that it is mainly occurred in men, middle aged 40 to 60 years. Here what will happen is it will cause increase in secretion of transforming growth factor. This transforming growth factor will cause increase in proliferation of epithelial cells, which will result in prominent gastric rugal folds, and these prominent gastric rugal folds will have an appearance of as bag of worms. So bag of worm condition is seen in the case of meningeal disease, right? Meningeal disease. Okay, now here the content that is written right here, you can see grossly it is associated with prominent gastric rugal fold. Yes, we already discussed about these things. It is characterized by over secretion of TGF, right? Transforming growth factor alpha. Okay, histologically it consists of foveolar cells, right? There will be large number of foveolar cells, and clinical feature: abdominal pain will happen, diarrhea will occur, right? Patient with meningeal disease have high risk of carcinoma stomach. Okay, now what is this? This was about what? This was about meningeal disease, right? Now moving toward what? Moving toward Zollinger-Ellison syndrome. Now talking about Zollinger-Ellison syndrome, what we will find here is, okay, talking about Zollinger-Ellison syndrome, what we will find here is it is associated with gastrin producing tumor. It is associated with gastrin producing tumor. So it is known as gastronoma. What it is called? It is called gastronoma, right? It is mostly malignant in nature, but sometimes it also appears as benign also. So now here in this gastronoma, what will happen? There will be more number of gastrin producing cells. Yes, we know that there will be more number of gastrin producing cells, and as there will be no more number of gastrin producing cells, there will be hypersecretion of gastrin, right? Hypersecretion of gastrin. So if you remember the fact, right, gastrin helps in what? Gastrin helps in what? Higher production of acids. We have mentioned this thing earlier also, right? We have mentioned that G cells, right, it secretes gastrin, and this gastrin causes what? Hypersecretion of HCl, right? So here what we are mentioning right here is it will cause increase in acid secretion, right? And as the acid secretion will occur, there will be impairment in digestion, and there will be diarrhea, and also there is a high chance of duodenal ulcer. That's all, right? Now moving toward gastronoma, there are two types of gastronoma that we are going to discuss. That one is sporadic, right? It is solitary type, and one is familial variant, right? And here in this familial variant is associated with main 1-like syndrome. Now what is this main 1-like syndrome? It is multiple endocrine neoplasia subtype 1 syndrome, right? And here about 25% of the cases are related with familial variant, whereas 75% are related with sporadic variant, right? Okay, now here in the case of this familial variant, there will be multiple tumor in different location, right? As we have mentioned right here, multiple endocrine neoplasia subtype. So there will be multiple tumor in different location in our stomach. So if you will see microscopically, what we will find is there will be increase in parietal cells, right? There will be increase in parietal cells. Okay, so that if we are saying that there is increasing in parietal cells, there is increase in what? Oxyntic mucosa, right? Oxyntic mucosa's thickness will be increased. So since here everything is increasing, so earlier we mentioned that this is also called hypertrophic gastropathy. That's all, right? Now talking about the diagnosis, how we are going to diagnose, either it is what? Zollinger-Ellison syndrome, or it is our what is the another condition? Meningeal disease. Okay, now diagnosis, what we will do is we will take a blood sample, right? We will measure the amount of gastrin. If the amount of gastrin in blood is greater than 1000 picogram per milliliter, then we will confirm that it is what? It is Zollinger-Ellison syndrome, right? Now we can also do another thing. We can just measure basal acid output. Now if the basal acid output is higher, then we'll just confirm that it is what? It is Zollinger-Ellison syndrome. Now in order to treat, right, this patient, what we can do is we can do surgical resection, right? Or we can provide anti-cancerous drugs. We can provide anti-cancerous drugs, right? Okay, this was about what meningeal disease, meningeal disease and Zollinger-Ellison syndrome. Now let us move toward what? Let us move toward the content in our book. And here what we'll see here is, here we'll find the brief discussion about stomach, right? We'll find the different part of stomach mentioned right here. Here it is mentioned about mucin secreting foveolar cells, right? Okay, that forms small glands. Here it is talking about the G cells that release gastrins. So this is mentioned right here. Now here it is mentioned about gastropathy. As you can see, inflammation of gastric mucosa occur in many conditions, right? And when we're talking about inflammation, we'll call it as acute gastritis, right? When there will be neutrophils, when there will be infiltration of neutrophils or WBCs, right? And in the case of gastropathy, right, when inflammatory cells are rare or absent, right? In this case, the inflammatory cells are rare or absent. And we talked about various conditions that may result in these two conditions, right? And talking about pathogenicity, right? Pathogenesis. Now what is mentioned right here is, right, here it is talking about several mechanisms that will protect our our stomach gastric region, right? These are included under protective factor, and there are damaging factor and our injurious factor. What they will do is they will try to just break the defense mechanism of our body, and because of this imbalance, what will happen? There will be the inflammations, and yes, these are the main causative agents, right? You can see right here. Okay, here what is mentioned right here is, right, here different mechanism, right, different ways that will give rise to gastropathies are mentioned right here, such as inhibition of cyclooxygenase, right? If cyclooxygenase will be inhibited, there will be no production of prostaglandin, and if there will be no production of prostaglandin, what will happen is that there will be lackage of mucin, right, that acts as protective mechanism. Similarly, inhibition of gastric bicarbonate transporter, right? By gastric bicarbonate, it neutralizes HCl, right, which is a damaging factor for stomach. Similarly, it reduces reducing mucin and bicarbonate secretion, same thing, right? Decrease in oxygen delivery to these region is also a risk factor to cause gastropathy, right? Okay, this was all about what? This was all about our gastropathies. Hope it is clear, right? So this much for this lecture. Hope you get it. Thank you and have a great time.